Autoimmune can happen not just in the thyroid, but anywhere.
Anywhere. And this will make sense if you'll bear with me for a couple seconds. The way I describe it to patients, if you and I were sitting here having this conversation, and some people don't like this analogy,
I'm sure it's going to be great.
It's the best one. But if we're sitting here having this conversation and we were to set a pistol on this table right here, and the whole time we're talking, it just sits there. Nothing's going to happen.
Right.
If bad people come in the door, one of us could take that pistol and do the job, right? It's there. But as long as we don't touch it, nothing's going to happen. Now, two things have to happen for that pistol to do any kind of damage. Number one, it has to be loaded. And number two, something or someone has to pull the trigger.
That's right.
Right. So in the analogy with autoimmunity, if that pistol is a useful part of our immune system, we could defend ourselves with it. Right?
Yeah.
If the genetics of any particular person has loaded that pistol, now there's a bigger threat because it's loaded. Let's say genetically you're prone to having a gluten sensitivity, right?
Okay.
That loads the pistol. Let's say genetically there's an enzyme you can't make in the liver that would detoxify a certain chemical. That may load the pistol. Right? Now, if you never come in contact with the chemical,
you don't ever
nothing
pull the
ever
trigger.
happens, right? Nothing messed with it. Now, our environment, we can't really change the genetics. We can't. Apparently Pfizer can, but we can't. But it's a different discussion.
That's right.
So the pistol sitting here, it's loaded, let's say, or presumably loaded. The problem that we deal with is what's fiddling with it. If I'm absent-mindedly flipping it over and turning it over the whole time we're talking, I'm messing with it, everybody watching this would be uncomfortable.
Yeah.
Like he's going to shoot Aaron, and we don't want that.
We don't want that. No, please.
Now, the medical community names autoimmune disorders by where that errant shot would hit you. If it hits you in the shoulder versus the hip versus the wrist versus the nose, they're going to name each autoimmune disorder differently. But you and I would agree that the mechanism of damage
is the same.
Is exactly the same in every one of them.
That's right.
Right? I'm not going to go put a little bulletproof pad in front of all the different places that might get hit. I'm going to say quit messing with the gun, because if you quit messing with the gun, it can't go off.
That's right.
We can't unload it necessarily, but we can quit messing with it. So our job is to run through a list of predictable manipulators of the gun and get them out of the way. Because if you quit messing with it, you go into remission. So you didn't cure anything.
That's right.
But you go into remission. If you mess with it again, it'll go off again.